Okay, I'm Yvonne Coghill, and I'm from the Leadership Academy, and I'm really delighted to be here. So thanks to colleagues for inviting me here this afternoon. First principle of the Constitution. We all know the Constitution, and we all live by the Constitution. That's why we're all in this room. It's basically to make sure that everybody gets the care that they deserve and they need in our populations. But the first principle, so when you open the booklet, the first thing we read is this, and it's very, very clear about what we're in business to do, how we're supposed to go about doing it. But more than that, it actually identifies and names the strands in terms of gender, race, disability, and so on. So it's really important. And we're talking about compassion in care. And compassion is about making sure that our services are high quality for absolutely everybody within our populations. And our first principle says it very, very, very clearly. Everybody deserves a high quality service, and I always start my talks with that, regardless of what I'm talking about, whether it's leadership or whether it's about diversity. This is what we're all in business to do. This is why we're all here, to make sure that all members of our population get a good service. London, place where I live, place that I love, absolutely adore London. Came to London from Bristol when I was 18 to do my nurse training in 1977. You don't need to do the maths, that's 36 years ago. And I've been a nurse ever since, and I love being a nurse. I'm proud of the NHS, and I'm very proud to be a Londoner. We have so many people in this capital, and Anne's already said there are many, many, many people here. 14 million visitors we have a year from different parts of the world, and 8 million people live in London. It's busy, it's vibrant, it's lively, it's a wonderful place to live, but it also means that there is a lot that we have to do in terms of healthcare because there's so many people living and working in London. So I think it's really important that we keep that in context, because when I'm talking to other people in other parts of the country, it is a little bit different in terms of the population that they have to serve. Some places in London, in the UK, I beg your pardon, have many more BME staff working in the organisations than they have actually in the population. So for example, if you go down to the southwest, you have 8% of the population who are from BME backgrounds working in organisations, but you only have 2% of the population who are from black and minority ethnic backgrounds. In London, it's very, very, very different. We have now in our schools more children from black and minority ethnic backgrounds outnumbering white children in London schools. That means that in future, we're going to have a population when they're 18, 19 years old, which will probably mean that we have a majority minority population, which is what they call it. And even now, we know that 40% of our population in London are from BME backgrounds. So there's a real issue here around diversity and difference, and working with difference in a way that we all understand and that we all work towards making sure that things stack up. In London, in the NHS, as I said, we have many, many people working. We have 40% of our hospital doctors are from black and minority ethnic backgrounds, and over half of our GPs are from black and minority ethnic backgrounds. And we have 30% of our nurses and midwives from black and minority ethnic backgrounds. And what I'm really, really pleased to see today is the diversity in this room. Usually when I'm standing on stage like this doing presentations, the diversity is not like this. I mean, I think there's probably a third of the workforce here today are from black and minority ethnic backgrounds, and I think that's credit to the people who have organised this programme, who have really focused on that. And Caroline, I'm looking at you, who's made sure that that happens. And I think that we ought to actually praise Caroline for being able to do that, because that doesn't happen normally. We've had lots of reports over the last few years. I mean, I think they would fill this room, the number of reports we've had on the difficulties that black and minority ethnic staff have in the NHS. And many of you will know some of these reports. We've had the Roger Klein report, which talks about discrimination by appointment, where if you're from a black and minority ethnic background, you have a less chance of getting a job than a white colleague. We've had the information that the RCM did recently, which actually shows that you're more likely to be disciplined if you're from a black and minority ethnic background. But over and above that, I'm going to whip on very, very quickly. This slide, and I hope you can read it because the light's shining right on it, actually shows that you are more likely to be disciplined if you're from a black and minority ethnic background. You're less likely to be selected for leadership and development programs, and on it goes. But the thing that I want people to understand is what that actually does to people, from a black and minority ethnic background, and how it makes them feel, because I think that's really important if we're talking about compassion in care, and how we make the link between compassion in care, engagement of staff, and actually being fair and equitable to everybody in your workforce. And I think that that's one of the things that I'd like to leave people with as we go along. And people often say to me, Yvonne, you talk a lot about race and so on, but what about gender? And I just want to show you this slide. Now, this report hasn't come out yet, but it's going to be coming out within the next 3 weeks. So you will get, and it's specifically based on boards in London. And what it actually says is, if you look at the bottom figure here, so lighten it up, 38.8% of our board members are women, which is not bad, really. I mean, I know that there's 80% of the workforce are women, but 38% is not a bad figure. I mean, we're still working towards making that better, but actually, it's not a bad figure. Keep that in your mind for a minute. And what we have here is lots and lots and lots of evidence about why it isn't working for black and minority ethnic people. Because when you look at the statistics here, in terms of, and this is London, 8.9%. And we actually don't know if that figure, we don't actually know if that's correct. And the person who's written the report said that he believes that it's going to be revised downwards. So we really do have an issue with senior leadership from black and minority ethnic backgrounds. And why is it important? It's important because of all the things that I've been listening to people talk about this morning. It's about role modelling. It's about making sure that people who are in the workforce have people who look like them to aspire to. So you actually think to yourself, well, actually, she did it. And just now I was in a session with Joan. And Joan was talking about the fact that she didn't believe she could be a nurse consultant until she actually saw somebody who looked like herself who was working as a nurse consultant. It's really important that we understand the power of role modelling and the power of actually having people who understand our populations to help us with commissioning, to help us to understand what we are dealing with within an increasingly diverse population. One of the things that happens to staff, and I don't know that people are fully acknowledge and understand this, when you do not feel cared for, you do not care. Any of us in this room, if we're not cared for, we begin not to care. And what happens to us as a consequence of that, and we have the evidence about this, is that you become very disillusioned. I won't tell you my own story, but I have a story about becoming disillusioned. And when you become disillusioned, you can become quite destructive. You can become quite arrogant, aggressive, unhappy, depressed, all those things. And you ask yourself, how does that impact on patient care ultimately? How does that impact on performance if you have a large section of your workforce that's feeling disillusioned, feeling that things aren't fair for them, feeling that actually I might be disciplined over and above my white colleagues if I do something wrong, feeling that I'm not actually over my lifetime going to be making as much money as my white colleagues, or I might need to have more qualifications to get half as far? What would that actually do to a huge members of the workforce in London who are actually feeling those things? How does that play out in terms of patient care? And how does that play out in terms of how they interact with others, with other members of staff in their organisations? So you need to consider and think about the impact of some of the inequities in the system and how that plays out in patient care, because that's the most important thing from where I'm coming from. All of you would have heard of Mike West. I don't think there's anybody in the NHS that hasn't heard of Mike. I'm very fortunate at the moment to be working with Mike West. He's doing some work with us at the Leadership Academy around engagement, and particularly engagement of top leaders around the diversity agenda. So that's all good stuff. But this is one of the things that Mike wrote after 10 years of looking at staff satisfaction and patient satisfaction surveys. And I think it's a really important thing. It talks about the best performing trusts actually have a real culture of engagement. And I think we all know that. I think at a cerebral level, we think it's the thing to do, and we know that it's what everybody's aspiring to. But I think even more important than that is this slide, which actually I found absolutely fascinating. And when I saw it in his report, I had had to read it 3 or 4 times, because what it says in red, I think, is incredibly important for all our senior leaders in the NHS. And if I was a chief executive or a senior leader in the NHS, I'd be taking this very seriously. Very, very seriously. Because what it says is, the greater the proportion of staff from a black or minority ethnic background who report experiencing discrimination at work in the previous 12 months, the lower the levels of patient satisfaction. I think that's really, really, I think it's so powerful. And I think it's something that we need to take note of, and it's something that we need to do something about. I know. I'm going as fast as I can, Mary. The experience of BME staff is a very good barometer of the climate of respect and care for all within NHS trusts. I think those are my key points, and because I'm being waved at, I will whip along very, very quickly. But only to say, in finishing, that if we want to have compassion in our care, we need to care for all of our staff. We need to make sure that things are equitable. If they're not equitable, let's look at that and find out what's going on in our organisations and do something about it. Demonstrable actions are what we're looking for. And what we haven't had is that we've had a lot of talk, lots of policies and so on and so forth. But what we're looking for is this, and it's ludicrously simple. And it's high quality care for patients, inclusivity and engagement, motivated, enthusiastic and committed workforce. Very simple. Finish. Thank you.